Happy Women's History Month to all you ladies tuning into this video. I believe that the time is now and is fitting that we are celebrating women to be talking about a very important issue affecting many women across the world. Uterine fibroid is so common that it may be affecting you, your sister, your mother, or your friend. It is believed that 1 in 4 women suffers from this condition. It has huge implications on your health, your emotions, and also your financial well-being. So in this video, I have brought in an expert to raise awareness about the condition because many women are suffering in silence. I want you to know that if this relates to you, that you are not alone and that there is help available. The first thing you need to do is to be aware of what uterine fibroids is so that you can take action. So join me in the next clip. Don't change that channel. Don't change that channel. This is important.
For the woman wanna call the lady her lover and Lord.
So I have in my midst today a very special guest. And I must say that she is a daughter of the kingdom. She's an expert in this field, and we'll be doing this discussion on uterine fibroids. Welcome to the channel, and I'm going to give you an opportunity to tell us who you are.
Good day, ladies and gentlemen. If you are listening by extension of your significant other, mother, sister, friend, whomever. Good day. My name is Dr. Saida Bowe. I am obstetrician, gynecologist, gynecologic, oncologist, all of those things. And yes, a child of the king. I am a mother, daughter, friend, cousin, and all of those things as well. So thank you for having me.
Okay. It's so good to have you. So the term uterine fibroids has been around for quite some time, but some persons may not be aware of what it is. So can you please explain what is uterine fibroids?
So uterine fibroids, the medical term for it is actually leiomyoma. And they are just a benign, smooth muscle tissue growth, right? So it's a smooth muscle tissue tumor, or smooth muscle tumor, that is within the muscle of the uterus, okay? There are different locations that these benign growths can be. Sometimes they are within the muscle. Then you have some persons that have them inside the uterus, inside the uterine lining. So when you put a camera inside of the uterus through the vagina, these ones would be within the endometrial lining. So you would see them as if they look as if polyps sometimes. They're little outpouchings, outgrowths inside, or they may be what we call subserosal. So they would be on the outside of the uterus, or they may be pedunculated, just hanging on kind of by a very small stalk onto the uterus as well.
Okay, thank you. So they have different presentation. They can be inside the uterus, sitting outside of the uterus, or hanging from the uterus.
Yes.
Okay, good. So then, seeing that it's a growth, then what caused these growths?
So that's a very interesting and a very good question. What causes the growths? So the growths is really just as a result of an increase in the replication of those smooth muscle tissues that can occur. And unfortunately, it is also something that is commonly seen in African-American women, Afro-Caribbean women, these are women that is most commonly seen in, and it's also believed that there is a genetic predisposition to that increase in the growth of those cells. So this is why you tend to have more of women of Afro-Caribbean or African-American women presenting with these symptoms.
Oh, okay, okay. So I know you mentioned the genetics as a factor and Afro-Caribbean women, but in general, who usually develops uterine fibroids?
So generally it is women within the reproductive age group. So women over the age of 20 to around between the ages of 20 to 45, you would tend to find this within those women. Okay.
Okay, thank you so much. So what are some symptoms of uterine fibroids or uterine fibroids?
So the symptoms are varied, okay? And some people may actually be asymptomatic. They have no symptoms at all, right? And it may just be an incidental finding. The symptoms also can depend on the size of them, right? And their location. Mm-hmm. Some women may have heavy menstrual bleeding. So it depends on where they're located. So are they within the musculature of the uterus or within the uterus itself, where there's now women that are presenting with abnormal uterine bleeding or prolonged or even heavy menstrual bleeding. Mm-hmm. Sometimes women may have infertility as a result of the fibroids, mm-hmm. and it's just because of location. Women may have urinary frequency, urinary retention. There's also the possibility of women having constipation, because if they are what we would call positioned posteriorly, mm-hmm. then they may be compressing on the rectum. And so sometimes women present with a constipation symptoms. Mm-hmm. You also have now the fact of women feeling that there's a growth, okay? Some mm-hmm. women may look like they are pregnant, and mm-hmm. unfortunately, some persons may say, oh, you're pregnant, congratulations, and they're not pregnant. It is just mm-hmm. because the fibroids, unfortunately, have grown so large that mm-hmm. it gives that appearance.
Okay, thank you. So the symptoms range from mild to severe severe symptoms.
Yes.
Okay, so how do you know that a woman has fibroids? What are the tests involved in diagnosing the condition?
So what are the tests involved? So when a female goes for her well woman visit, which we should do annually, I will put that plug out there that, annually a woman should have a well woman's visit. And in that well woman's visit, your physician would obviously examine you, do an abdominal examination. And so if these fibroids are big enough that they can palpate underneath your skin, that there is a growth, then most times the physician would order further testings, being those of an ultrasound scan usually, to determine and make sure that this is actually a growth that's in the uterus and not something from the ovary or somewhere else. So generally we would start with an ultrasound scan to see what is the growth that we're feeling or palpating on examination. Mm-hmm.
Okay. Yes, I'm happy that you mentioned that there can be, this condition may be asymptomatic, and not knowing that you actually have it can lead to complications in later years. I understand that some are very small, and that's the reason why they don't produce symptoms. And it's so important to know. So speaking of complications now, are there any complications to uterine fibroids?
So generally they're not complications per se to having them. It's just what symptoms are you going to have and how are those symptoms going to impact your overall health, right? Because if a female is married and she is having, unfortunately, irregular bleeding as a result of these uterine fibroids, that can cause sometimes a significant amount of stress within her marital relationship, mm-hmm. because now she may be having prolonged menses and bleeding for 20 days out of the month, and that there can be, like I said, cause a strain within her marital relationship. Also, it can also cause problems where she may require frequent blood transfusions because of the heavy prolonged bleeding. Her hemoglobin unfortunately drops, and then she may require blood transfusions. Sometimes you find that some women, because they become so accustomed, or their bodies become so accustomed to it, that when you do check their hemoglobin, you're startled, because it's like, how are you functioning with such a low level of a hemoglobin? But their bodies have gotten so used to it that it doesn't seem abnormal to them to be walking around with a low hemoglobin, right? So that's another thing. And then sometimes, because of the prolonged bleeding, some women actually would call in from work, and so you're having missed days at work as a result of this condition. So there's no specific complications as such, but it's just, how does this impact the overall patient globally is one of the things that we also look at.
Okay, so missed time from work can cause a strain on your marital relationship, as well as it can lead to symptoms of anemia.
Yes.
Okay, thank you so much. So from my experience, I know that some persons are quick to think of surgery as the only treatment option. Can you explain what treatments involved for you? What are the treatment options for uterine fibroids?
So there are medical treatment options that are available for patients with uterine fibroids. And the thing that we look at when we're coming up with a treatment plan, we want to, again, take the whole patient into context, right? So we look at the age of the patient, right? What are the patient's reproductive desires? So is this a patient who is desirous of future fertility? And even if she is not, is the patient fit enough for surgery if surgery is an option? So everything has to be looked at in totality when coming up with a